Assalamu alaikum. Welcome to 168 Hours, your weekly roundup of the top local stories. I am Mariam Shaushat, your host for the evening. President Dr. Mohammad Muizzu states that the government is pursuing modern solutions to strengthen rehabilitation and reintegration of young offenders.
The president made the remarks in the third episode of the Pulse podcast, which focused on the national response to drug abuse. He said the government's core policy is not only to protect young people from drug addiction, but also to ensure those already affected are rehabilitated and given the opportunity to return to society as productive, respected, and self-reliant citizens. President Muizzu noted that there are numerous factors driving people towards drug abuse, stressing that the problem can only be solved by identifying and addressing its underlying root causes. He explained that housing difficulties and shortcomings in development policies are among the structural issues contributing to the problem. He said the government's response therefore extends beyond law enforcement and rehabilitation programs. Measures include addressing housing needs, expanding employment opportunities, creating new income-generating prospects for young people, and supporting small businesses. The president also highlighted initiatives aimed at strengthening individual self-reliance, creating opportunities for women to earn an income while working from home, improving the country's healthcare system, and expanding access to education. He said these initiatives are all designed to tackle the root cause that lead young people into drug abuse and crime. President Muizzu revealed that the government is developing a modern rehabilitation project to enhance the reintegration of young offenders into society. Although the initiative will require significant investment, he said land has been allocated in North Tilafadu for the project as part of wider efforts to ease housing pressures in Malé. Providing an update on the project, the president said considerable time has been spent securing financing. Proposals submitted for the projects are currently under evaluation, and he expressed hope that implementation would begin without significant delay, allowing tangible progress to be seen during the current presidential term. The episode also featured President Muizzu responding to public concerns relating to the day's topic. The Pulse podcast is hosted by the government's chief spokesperson Muhammad Hussain Sharif and follows a format in which the president shares his view on key national issues and answers questions submitted by a moderator on behalf of the public.
Minister of Homeland Security, Labour and Technology Ali Ihsan says that the most important mission the police must accomplish with the greatest determination is protecting the Maldives from the drug epidemic.
Speaking at the graduation ceremony of the 42nd Basic Police Training Course, the minister highlighted the country's crime situation and the responsibilities that lie ahead for the police. He said that for many years, the greatest threat to the Maldives' internal security has been the problem of illicit drugs. He also noted that organized crime is largely financed through the drug trade. The minister stressed that tackling the drug problem is essential to safeguarding the national interest. Although it is a difficult task, he said significant progress has been made over the past 2.5 years. He also urged the police to remain fully prepared to respond to the broader range of crimes affecting the country. During his address, the minister also outlined how police officers should approach their duties. He said the police's greatest weapon is not a baton or any other piece of equipment, but the public's trust. Serving with integrity and humility without arrogance is essential to fulfilling the police's responsibility and maintaining public confidence, he said. The minister had previously stated that the full results of efforts to dismantle drug trafficking networks would become evident next year. He also said police operations targeting those involved in the drug trade would be intensified further in the coming year.
President Dr. Mohammad Muizzu states the negative influences of illicit narcotics that previously existed within the police institution have been thoroughly eliminated, and the law enforcement service itself has been further strengthened.
These remarks were delivered during his appearance on the third episode of the Pulse podcast series. The president noted that significant efforts have been undertaken over the past 2.5 years to expand the operational capacity of the police to rescue the nation from the drug epidemic. He maintained that the primary objective of these initiatives was to establish a systematic framework capable of addressing narcotics violations directly from within police departments, thereby empowering the force. The president observed upon assuming office and conducting an initial review, adverse influences were identified within the police's drug enforcement division. He underscored opportunities to engage in such nefarious activities have now been entirely dismantled. The president asserted ongoing administrative efforts to resolve gang criminality and drug-related offences are yielding positive results. He explained that the number of individuals participating in gang crimes has decreased and gang-related homicides has seen a substantial decline. Various government agencies are operating collaboratively, and the president noted that a permanent resolution to the narcotics crisis will ultimately be achieved.
The Civil Service Commission gazettes an amendment to the Civil Service Regulations, introducing a formal framework for emergency-related absence and remote work arrangements.
Under the revised regulation, civil servants may request permission to work from home or another off-site location when a medical professional registered with the Ministry of Health or a locally licensed health center certifies that the employee cannot attend the office because of an emergency. The amendment stipulates that permission will be granted only if the employee's assigned duties can be carried out effectively outside the office, and if the employee has the necessary resources and a suitable working environment. Employees approved for work in absentia must be assigned tasks that can be performed remotely and must be supervised and monitored daily to ensure uninterrupted delivery of public services. Should the employer deem the employee's performance inadequate, the remote work arrangement may be terminated immediately. All staff who are permitted to work off-site must sign a confidentiality agreement committing to protect official information and to remain reachable for any urgent office summons. The regulation also carves out exemptions for sectors where physical presence is essential, with teachers, nurses, and senior management staff being automatically excluded from the remote work provision, as their roles require on-site attendance.
Chief Executive Officer of the Mala City Group of Hospitals, Ibrahim Abdurrazzaq Halim, says public confidence in the Indira Gandhi Memorial Hospital, IGMH, has increased significantly following the establishment of the National Cardiac Centre. Speaking at a ceremony marking the centre's 10th anniversary, Ibrahim Abdurrazzaq Halim said the National Cardiac Centre has become one of the most successful and specialised facilities operating under the Mala City Group of Hospitals. He said the centre has set a benchmark in the delivery of specialised healthcare services, adding that continued improvements in the quality of care have strengthened public trust in IGMH. Chief Executive Officer of Mala City Group of Hospitals, Ibrahim Abdurrazzaq Halim, said the establishment of the centre has significantly improved cardiovascular services in the Maldives, allowing patients to receive treatment for heart conditions within the country instead of travelling overseas. He added that the National Cardiac Centre has made significant progress over the past decade and continues to pursue important goals for the future. He also said the centre plays a vital role in reducing the number of patients seeking cardiac treatment abroad while helping to develop skilled local healthcare professionals. Highlighting ongoing developments, the CEO said services at the Cath Lab in Addo City, which began operating in February, are progressing successfully. As part of the official negotiations towards a free trade agreement between the Maldives and India, consultations have been held with relevant stakeholders on technical barriers to trade, TBT. The Ministry of Economic Development, Transport and Trade stated that the purpose of these discussions is to identify the challenges faced by businesses and explore ways to address them through the FTA. Technical barriers to trade, TBT, refer to regulatory and technical requirements that can affect trade between two countries. These include product standards, testing procedures, certification requirements, and labeling regulations. The meeting, attended by government agencies and companies involved in the Maldives export sector, focused on measures to ensure the safety and quality of goods traded between the two countries. Discussions covered sanitary requirements to ensure imported and exported products are safe for human and animal health, as well as phytosanitary measures designed to protect plants and agricultural products. The decision to launch negotiations on a free trade agreement between the Maldives and India was signed during Indian Prime Minister Narendra Modi's official visit to the Maldives last year. In March this year, the two countries agreed on the terms of reference TOR required to begin the negotiations. The TOR serves as the framework that sets out the scope, objectives and procedures for negotiating the agreement before the final FTA is concluded. Minister of Infrastructure, Housing and Urban Development Dr. Abdullah Muttalib reveals the government plans to enable essential services for residents of Hulumale Phase 2 to be provided on plots allocated to private owners.
The minister made the remarks during the inauguration of the project to install additional lifts in the Hia Towers. Dr. Muttalib said that more than 2,000 plots had been allocated to Male residents in Hulumale Phase 2 and Phase 3. At present, these plots are designed solely for residential use. However, he stressed the importance of allowing private sector investment so that essential services could also be established within these areas. He noted that similar services are already available on privately owned land in Male and said residents of Hulumale should have access to the same opportunities. He added that this approach would not only benefit plot owners but also strengthen Hulumale's economy by creating new jobs and business opportunities. He added that the government would work closely with the private sector to develop plans to facilitate this policy. The aim, he said, is to overcome land constraints and the shortage of essential services by making better use of existing plots. Turning to the Hia housing scheme, Dr. Muttalib acknowledged that one of its biggest challenges is that many families living in two-bedroom flats have since grown in size but currently have limited opportunities to move to larger accommodation. Although he did not announce any specific measure, the minister said the government recognizes the difficulties faced by Hia residents and is considering possible solutions. He said future housing policies would focus on improving the living standards of those already residing in government flats while creating opportunities for them to move into larger, more comfortable and better quality homes. He added, the government remains committed to improving housing conditions and expanding options for residents.
First Lady Sajida Mohammed says healthcare is not merely a public service but the most important service for establishing equality and equity in society.
The First Lady made the remarks while addressing the opening ceremony of the 3rd International Joint Conference for Healthcare Professionals 2026, held with the participation of healthcare professionals from the Maldives and 9 other countries. Speaking as the chief guest, Sajida Mohammed said conferences of this nature bring together healthcare professionals from different fields, creating opportunities for meaningful dialogue and collaboration. She said such discussions not only contribute to the advancement of the healthcare sector but also represent an important step towards improving the well-being of communities. The First Lady noted that a society without good health cannot achieve sustainable growth and development. She also acknowledged the dedication of healthcare professionals, saying every stage of a patient's treatment depends on the commitment, hard work and professionalism of those working across the healthcare system. Referring to the developments in the global health sector, First Lady Sajida said the Maldives is making significant efforts to adapt modern innovations and improve healthcare services. She added that conferences such as this provide valuable opportunities to exchange ideas, share research findings, and identify practical solutions to challenges facing the sector. The First Lady also paid tribute to nurses, describing them as healthcare professionals who remain closest to patients throughout their treatment. She commended their dedication and the support they provide to patients and their families during difficult times. Concluding her address, First Lady called on all stakeholders to continue working together through dialogue and research to identify the changes needed to further strengthen the Maldives healthcare system.
The government submits amendments to the Waste Management Act that include easing the levy charges on plastic bags.
The bill, submitted on behalf of the government by parliamentarian for Ungu Faru constituency Ibrahim Shifaz, was introduced for its first reading in Parliament on Tuesday. The proposed amendments include a complete ban on the import of waste into the Maldives and introduce a range of measures aimed at strengthening waste management regulations. They also propose scrapping the $0.13 levy currently charged per bag on bundles containing more than 50 plastic bags. As a result, government revenue generated from the plastic bag levy is expected to decline. According to the bill, the amendments are intended to more clearly define the roles of institutions responsible for implementing the Waste Management Act and facilitate more sustainable waste management practices. The bill also seeks to formally prohibit the import of waste, improve the planning and implementation of waste management activities, and address challenges encountered in enforcing the law. Other proposed amendments require businesses engaged in economic and industrial activities to develop waste management policies. The bill also stipulates that waste management activities must be aligned with the National Master Plan and City Waste Management Plans. In addition, the amendments provide for the establishment and implementation of waste management systems, the setting of waste management standards, reforms relating to waste management facilities, and the introduction of standards for equipment used in waste management. According to the bill, the proposed changes are expected to provide a more comprehensive legal framework for addressing waste management challenges in the Maldives.
President Dr. Mohammad Muizzu calls on Maldivian writers to uphold truth, patriotism and national values in their work, saying writers should produce work that brings honor and distinction to the country.
In a post shared on social media, President Dr. Mohammad Muizzu extended his congratulations and best wishes to all Maldivian writers and the public on the occasion of the Maldives' 34th National Writers' Day. The president said that the noble religion of Islam encourages education, the dissemination of truthful information, and the advancement of writing and literacy. He therefore advised everyone who writes in the Divehi language to promote truth, communicate with courtesy, and share positive ideas and reflections that will benefit both present and future generations. President Muizzu said that Maldivian writers should be trustworthy, patriotic citizens who write in ways that will always make the nation proud and enhance its reputation. National Writers' Day in the Maldives is observed because of the country's first magazine that was published on 8th July 1933. The publication was called Al-Islah. However, the day was officially recognized and first commemorated nationwide on 8th July 1993. Looking at Maldivian history, writers have played a responsible and significant role in the development of the nation. Religious scholars have contributed through Islamic scholarship, literary scholars through literature, and historians through historical writing. Journalists and political figures have also made important contributions in their respective fields.
And that's all we have in this bulletin. Stay tuned for next week. Have a good evening. Goodbye.